I've had the privilege of visiting over 35 countries over the last 18 months, and in every single country, developed or developing, the issue of the financial sustainability of their health system is usually their number one priority. Whether it's in the developed world, where you have what I call pains of old age, sluggish economic performance, an ageing population, and the rise of long-term conditions, all placing pressure on government funds or insurance funds, or whether it's in the developing world, where you have pains of expansion, a young population and a growing middle class demanding more services from their insurers or their governments. The sustainability of health systems from a fiscal point of view is mission critical. I'm delighted to be able to sponsor this KPMG Nuffield European Summit on funding reform, because wherever I go, and let me just give you a few examples, there are big debates taking place. So let me just take 4 different countries. In Australia, new government reforms are now looking at the introduction of a new independent pricing authority. They're trying to get the mix right between setting proper tariffs in both primary and also secondary care. In South Africa, where I was last week, their government now is thinking about a very ambitious launch of a new national health insurance programme. They're also thinking through how they can actually make pricing and costing more transparent in both their public and also their private hospitals. In Saudi Arabia, where the King recently announced a $50 billion investment in their health services, they're looking at the best way to provide state insurance for their 27 million citizens, and also to use an example which is been developing and is now certainly developed. If you look at Singapore, some of the work that we're doing there is that they know that they're very dependent on their hospital services, yet the rise of long-term conditions and chronic disease means they have to think about their funding formula and how they switch activity from secondary to primary care. So the bad news is no country in the world has got the optimal solution yet. The good news is there are more similarities than differences in global healthcare, and conferences such as this really do help spread learning, share learning, and I hopefully also think that we'll develop deeper insights into some of these pernicious problems. Well, historically, of course, in the developed world, the introduction of DRGs, diagnostic related groups, really have been the mainstay for funding and recognising activity and performance in the hospital sector. Traditionally, those HRG groups are applied to secondary care, and a form of capitation funding is applied to primary care. What many countries are now finding is that those two systems don't actually happily coexist. As you have an ageing population with more comorbidity, more long-term conditions, of course primary care is moving into secondary care and secondary care is starting to move into primary care. So those two funding systems, which have largely developed from the 80s onwards, are now rubbing against each other. So the number one priority is how do you actually integrate care services to provide greater value to millions of people that suffer from long-term conditions or the effects of ageing, whilst moving from perhaps a fee-for-service system into a bundled payment system. And of course, at the forefront of these reforms is the United States of America. They have many pressing issues, as you well know, 17% of their GDP spent on health. But to a lesser extent, other countries in the world face exactly the same issues. I think European summits such as this, organised and hosted by the Nuffield Trust, are very, very important. In my 23 years worth of experience, largely as a practitioner and a policymaker, I think it's very important to have a very solid international evidence base. And so we must do that. But of course, that in itself is not enough. Politicians move very quickly, populations move very quickly, patients demand things very quickly, and therefore I think the infusion between an academic, robust evidence base and policy and practical implications for execution are very important. So I would hope that we have more of these events. Over time, I hope that we grow a much bigger community of interest, which is fused between policymakers, practitioners and academics. If we can do that, I think countries can learn from each other very quickly and, more importantly, implement with some speed and precision as well.